hearing is the Health and Human Services panel that includes Child Support Enforcement Agency, Job and Family Services, our Family Stabilization Unit, as well as Office on Aging and Justice Policy and Programs. I will turn over the presentation to Deputy County Administrator Joy Bivens.
Good afternoon, Commissioners. My name is Joy Bivens. I am the Deputy County Administrator of Health and Human Services for Franklin County. About a year ago, you appointed me to serve as a Deputy County Administrator overseeing your Health and Human Service agencies, which entails Job and Family Services, Child Support Enforcement, Office on Aging, Office of Justice Policy and Programs, as well as our Family Stabilization Pilot. You charged me with integrating our agencies to better meet the needs of residents. The challenge of our silo systems was a theme that arose again and again throughout the conversations with hundreds of residents, single moms, justice-involved residents, seniors at Poindexter Village, homeless residents in encampments off South High Street throughout the development of your Rise Together blueprint. The COVID-19 pandemic, the ensuing economic downturn, and the nationwide reckoning with racism only elevated the issue. For us, there can't be a return to normal because normal wasn't working for poor people, normal wasn't working for residents re-entering society after incarceration, normal wasn't working for seniors who found themselves caring for grandparents or struggling on a fixed income. With the rise in cost of continual economic downturn. Over the last year, your Health and Human Service agencies have begun collaborating to a greater degree than at any point in our county's history. From regular meetings at the director and senior staff levels, to cross-agency teams working together at community events, to meet our residents where they are. We are a cross-training staff from each agency to support our new mobile unit to ensure residents can access the support they need without making trips to each of our offices. And if there's one thing we've learned from this pandemic, we need to provide virtual options, not just face-to-face. That's why staff from each agency has worked together to develop our new Franklin County Resident Services Portal, an online hub to connect residents with information about our programs, publicly funded childcare, workforce development for obligors, addiction and recovery services, our caregiver support, and dozens of other resources available from our network of community partners. We will be launching the new Resident Service Portal later this month. Around the same time, we will begin in earnest with our One Door project, an unprecedented effort to recenter all of our systems and processes around families and residents. It's a theme that you will hear again and again in these testimonies. It is an approach I will outline in greater detail in my closing remarks. And with that, unless you have any additional questions, I would like to invite the Franklin County Job and Family Services team to kick off our Health and Human Service testimonies.
Good afternoon, Commissioners and County Administration. My name is Christy Russell. I'm an Assistant Director and Chief Financial Officer for the Franklin County Department of Job and Family Services. Our agency's 2022 proposed budget is $101.7 million. This recommended budget includes $46.5 million in personal services and fringe benefits to support our dedicated staff. Our staffing level target for 2022 is 630 full-time equivalents, or FTEs. While we maintain staffing levels above 630 FTEs for the first 4 months of 2021, they have declined over the last several months, a trend experienced across the state, and as of November 8th, we have 581 FTEs. Our recommended budget also allocates $10.2 million for materials, supplies, services, and a capital building lease, including $2.3 million for temporary staffing, a reduction from $2.8 million in the 2021 budget. The remaining $45 million of our recommended budget is reserved for social service contracts and programs to directly assist our most vulnerable residents. I'm more than happy to field any questions that you may have about our finances and the 2022 proposed budget. However, we would like to use the bulk of our testimony to highlight some of our accomplishments from this past year and preview some upcoming initiatives. For the latter, I will now turn it over to Assistant Director Vivian Turner.
Good afternoon, Commissioners. The last 20 months has been an unprecedented test for our county's social safety net. We have seen our roles for core public assistance programs like Supplemental Nutrition Assistance or SNAP, Medicaid, and the Ohio Works First Cash Assistance Program balloon amidst a wave of layoffs last spring. Indeed, we have more residents and families on SNAP today than we did in November of last year, even as emergency relief programs like the expanded unemployment benefits have been allowed to lapse. The majority of our working age residents have continued to work throughout the pandemic, but too few have been able to earn wages high enough to move them off of public assistance. Despite that, our staff have met or exceeded state timeliness requirements for processing SNAP applications throughout the past year, thanks in no small part to the additional overtime that you have authorized. This past spring, we participated in a listening session with the U.S. Department of Agriculture to discuss changes to the formula used to calculate SNAP benefit allotments, known as the Thrifty Food Plan. We urged them to revise the formula to increase the purchasing power for SNAP, which has failed to grow at the same pace as the cost of a nutritious diet. In August, the USDA announced it had reevaluated the formula, increasing the purchasing power by 21%, the largest increase in over 50 years. On October 1st of this year, the average SNAP benefit increased by $36.24 per person per month. This was a welcomed, timely relief for food insecure families. As the federal eviction moratorium came to a close, we have seen a boom in applications across our suite of prevention, retention, and contingency housing assistance programs. In June, we launched our most extensive program yet, our PRC Emergency Rental Assistance. The new ERA program provided us with the flexibility to cover up to 100% of the arrearages and up to 3 months of prospective rent for families that met the federal income requirements. Through October of this year, we have approved over $2.3 million in emergency rental assistance to support nearly 900 families, receiving an average of over $2,500 per family. When accounting for our parallel CARES Act PRC programs and our TANF-funded PRC Emergency Assistance Program, we have approved over $4 million in rental assistance to help keep nearly 2,400 families in their homes just this year alone. We have also pursued a robust outreach strategy, from having JFS street teams attend community events, to radio commercials, to partnering with NBC4 to host a phone bank doing their nightly newscasts. This person-centered outreach approach is the centerpiece to our broader strategy of integrating county health and human services, which will expand and evolve over the next year. That will be critical as our agency faces an unparalleled challenge to Medicaid and significant transitions for our publicly funded child care program, both of which will be discussed further by our Assistant Director, Michelle Lindenboom.
Thank you, Vivian, and good afternoon, Commissioners. Since the onset of the pandemic, the federal government has granted a waiver that has exempted us on acting on redeterminations for Medicaid, helping to ensure that our most vulnerable residents do not lose health care during a once-in-a-generation pandemic. However, the state legislature took steps in their recently enacted biennial budget to require county JFS agencies to conduct redeterminations for all Medicaid enrollees within 90 days after the federal public health emergency is rescinded, and that could be as soon as January of next year. Currently, we have over 463 residents on our Medicaid rolls, and upwards of 63,000 have yet to complete the renewal process. To meet this challenge, as well as complete our normal work of timely processing of new applications, including those we received during open enrollment for the Affordable Care Act, we will have to take an all-hands-on-deck approach. However, even with pulling from other departments like workforce development to add capacity, we project that we will need upwards of 15,000 hours of overtime over the 90-day span to meet this largely unfunded state mandate. At the same time, the state is moving forward this year with plans to transition publicly funded childcare to the Ohio Benefits Eligibility System. PFCC is the last of the agency's core benefits programs that is still processed using a legacy eligibility system. And this will be a significant undertaking requiring retraining of staff and educating our residents. Franklin County is tentatively slated to go live accepting new applications for PFCC through Ohio Benefits in May 2022, with renewals moving to the platform the following month. And what we have learned through previous phases of this year's long project is that state timeliness can be fluid. However, we believe that with this conversion completed, our system will be better tailored to meet our residents' needs. That is a sort of aligned family-centered approach that is at the heart of our one-door strategy for all of our county health and human service agencies, a theme you will continue to hear in the coming testimonies. But in the meantime, we will all be happy to answer any specific questions that you may have about our proposed 2022 budget. Thank you.
You will now hear from our Child Support Enforcement Agency Director, Susan Brown.
Oh, before you go, I wasn't sure if there was another component. I wasn't expected it to go so quick. So I'm just trying to catch up here. I want to just tell everybody, when you're presenting, it's hard to keep up when you're kind of going through it at the same time and you're kind of reading through. And so you may say something and I get stuck on reading it in the document, but you're now, 3 paragraphs ahead. So I just want to warn everybody about that. That's kind of the issue for me. But can you just zero in, maybe Deputy Administrator, on the change in budget and what that particular change means in terms of the budget again? I might have missed it in trying to keep up on something else.
Christy, can you go over our allocations with Commissioner Boyce, please?
Yes. The breakdown of our 2022 budget.
Yes.
So
And really just what the change is, the change from last year to this year, and where those funds are,
Right.
What that's going to. You can just zero in on that.
So Christy, can you keep it high level? We did like 90 million last year. Where do the additional dollars come from for him? So he'll.
okay.
Thank you.
Well, I get into the weeds, so I'm trying to figure out exactly how. Let me pull up. I know a lot of it, and I don't have. Let me pull up the exact. Or if we want me to pull the numbers and then I can address the question at the end, that might be a better use of all of our times. But a lot of it is the additional CARES Act money, ERA money, and the ARP money that we've gotten in we had some in 2021, but comparing our budget in 2022, which causes our revenues to go up significantly, and then also our contracting dollars to go up. I'm trying to do a quick, because I think the bulk of it is in our contracts.
Yeah, it says 5.8 million for social services, but I'm just trying to understand, like, are there specific things that are being addressed with that 5.8 million? Because it says 5.8 million for social service, 1.1 million for personnel services, and then the rest is for fringe benefits. But I'm just trying to see what is it in the social service that we're doing more of, less of, whatever. Where does that? What is the specifically the increase to?
Okay,
Well,
so I'll give a general answer and then I'll defer to Vivian for a more specific answer.
Okay, thank you,
Okay.
Christy.
So the budget is put together with, based on revenues that we anticipate, and then how much money we have of those revenues that we can utilize for community contracts. So in the revenues, we've anticipated the allocations that we get from the state, and then also the additional funds that the Board of Commissioners have indicated at the time of what we were receiving from CARES Act, ERA, ARP, and those types of funds, which those are all kind of new in the last year or two. And so with the amount of revenues that we've been communicated that we will receive, Then we develop the budget, and then we have like a big block of funds that are available for community contracts. And then I provide that information to Vivian and her contract team to then work with the commissioners and county administration and priorities to determine how those dollars will be spent. So based on that, I'm going to pass it off to Vivian and let her maybe specifically answer what your question is.
Vivian, and before you speak, Vivian, can you hone in on the additional dollars that we put into the PRC Plus?
Yes, I will do both. So basically, Commissioner Boyce, those dollars that the 5.8 that she mentioned went to programs such as summer employment and summer jam that we did this past summer for youth. It also supported the Building Futures expansion as well as the Roads to Work expansion. So those are the primary for our ARP dollars. Quite a bit of that went to those costs. In addition to, as Deputy County Administrator Bivens mentioned, we've had a significant increase in rental assistance dollars. So we have had 2 ERA allocations totaling $3 million and another PRC Plus, which was CARES Act, about $1.5 million.
And Vivian, I don't want to put you on the spot, but I do want to make sure for the public, we did invest significant dollars into the our early learning, correct?
Yes, we also did have some CARES Act. I think that may have been Deputy County Administrator in the 2020 budget.
Yes.
Where we gave grants, special grants to child care providers last fall.
Yes.
Child care stabilization grants, totaling about $7.7 million.
Right.
Did I answer your question, Commissioner Boyce?
I think so. I mean, I'm trying to figure out the 2022. You said you were making a reference to what we did this past summer, but I presume that has an implication for this year. It is why you're telling it that way.
Yes.
Yeah.
Okay.
So Chrissy can explain how it's budgeted. I can tell you where we spent the money.
Well, I guess I'm looking at where we're going to spend it. So I'm looking at 2022.
So we do have some proposals that are pending, Commissioner Boyce, but we don't have the amounts in the budget because we haven't actually gotten the actual budget amounts from those providers yet. So there are things that are pending, such as we're going to be working on the cafeteria project that will be coming up recently. We're waiting on a budget from our community partner. We're going to do some other workforce training programs that are currently outstanding, but we don't have the exact amount for those initiatives.
Can I jump in just really quick, Vivian? Commissioner Boyce, I just want to keep in mind that a lot of the initiatives that Job and Family Services will be funding will mirror things that we've done in the past as it relates to after-school program, enrichment services, some of those same exact programs, as well as these additional efforts that Vivian Turner just outlined regarding the cafeteria, increasing in our driving futures, our building futures, as well as our Roads to Work programs. So what I could do is we could send you that budget outline with those exact numbers once they're solidified, if that is what you request.
But some of the numbers, to get to Commissioner Boyce's question about why the 2022 budget is increasing, some of those dollars are included in the budget that were started in 2021 going into 2022.
Right.
So that is why we are seeing an increase from the 2021 budget to the 2022 budget. But also what Vivian's referring to is there are additional dollars that are currently being discussed that have not been solidified on the amount or exactly how they'll be spent. And those are not even currently included in the 2022 budget. So we will need to revise our budget even further. So some of the increases and dollar amounts that we are aware of are included in the budget, but some of them are not.
Okay.
We can certainly follow up as those things become, we have the more solidified, Commissioner, and let you know ahead of a general session.
Okay.
Thank you, Vivian. Thank you, Christy.
I have a question. about the FTEs. So I see for 2021 budget, there was, I guess, approved 679. And for 2022 is 699, the additional 20 positions being for case managers. But in the testimony, Christy said that you currently have 581 FTEs. Is that right?
Correct.
So I'm just trying to understand where, I guess, the need for the additional case managers at this point in time, and what are the, I mean, you're down almost 100 FTEs already.
So the additional 20 is not really an additional 20. We've always had those 20. Those are what we consider training case manager boxes that we've always been authorized to fill, even though we would, so our approved budgeted FTE was 679. We've had the 20 case manager training boxes for the last several years. They were just not in our approved count, even though county administration and county HR would allow us to fill the training boxes, but we would never go over 679. So with the transition of the new PCNs and transition to Chronos, we had to put the 20 FTEs into our number so that we could utilize those boxes because of the systematic change. So we worked with OMB to include the 20 positions, but we did not put any dollars associated with those 20 into the budget. It is literally just in the FTE count, so we can use those 20 training. It helps us with our union contract and timing and stuff, not to get too much into the weeds.
Right.
But it's basically boxes that we can use to, in an attempt to get staff in sooner rather than later. But there are no dollars associated in our budget for those additional 20, because if we have any portion of those 20 filled, there would be other boxes in our agency that would not be filled, that we would be temporarily using the 20 PCNs and then moving them into what we consider permanent PCNs.
This is
Did I
County-
answer your question?
If I could come in and try to explain, there was a period of time of a number of years back, as Christy Russell outlined, our numbers were lower than we liked, so we allowed training spots and created a training unit so that we could accelerate our efforts to get case managers on the job. And because of the fact that we always have a significant number of vacancies just because of the way we operate, we were able to do that and stay in line with the commissioner's authorization of total positions in any given year.
Okay.
But due to our
Go ahead.
due to our transition and the usage of Chronos, we had to give these positions PCN numbers.
Okay.
So
I
they
think
are
I-
a revolving group that you sort of, you're in a training unit and then you graduate into a position. And it's
Right.
You're putting it in plain speak.
Right, because it was taking so long. And Commissioner Crawley, we recognize that our numbers are down, as you see. There was a time when I think we were up to 600 and I don't remember, 620. But as you know, the rest of the country and the world and county, we see people who are leaving the workforce. One of the initiatives that we have this year is to not only hire, but work on retention, particularly for Job and Family Services, because as you know, the workload, it is needed and necessary to have the number of FTEs in order to process that work.
Thank you.
Are there any more questions?
I don't have any right now.
Okay. Okay, can we move to child support enforcement with Director Brown?
All right. Thank you, Deputy County Administrator Bivens. Good afternoon, Commissioners. I'm Susan Brown. I'm the Director of the Child Support Enforcement Agency, and I'm proud to be here today to represent the staff and the work of the CSEA and to present the agency's 2022 budget. This presentation will provide a very brief statement of our budget, our collaborations, our 2021 agency accomplishments, challenges, and key policy initiatives. The CSEA's 2022 recommended budget is $23,898,593. 75% of the budget is attributed to personnel costs and fringe benefits. The remaining 25% is attributed to materials, services, and grant projects. Additional details about our recommended budget and funding streams can be found in a supplemental handout that's available. The Child Support Program encourages, next slide please, responsible parenting, family self-sufficiency, child well-being by locating parents, establishing paternity, establishing orders, and obtaining child support for 80,831 children. We couldn't accomplish our program's core services without the assistance of our interagency and community partners, who provide services in career development, job training, positive parenting, and other wraparound services. This work directly aligns with goal number 4 of the Rise Together Blueprint for Reducing Poverty, which provides for improving and increasing delivery of supportive services for individuals to access employment, and with goal number 12, increasing the number of children in safe and stable homes and environments. We can visualize our work using this strategic bubble chart, with our core services in the center and our partnerships in the peripheral bubbles. These partnerships drive our overall success. Many of our agency accomplishments are outlined on this slide and are all focused on how we can increase our functionality and productivity. We focused on operations, creating and managing a hybrid work environment, and in doing so, took the opportunity to enhance remote performance accountability. We streamlined our meeting and communication protocols, and we're working toward enhancing our telecommunication technology. Our Performance Center also focused on operational improvement, utilizing staff surveys to build stronger, more productive team relationships. And we began the work of educating our staff on issues of diversity, equity, and inclusion. And we promoted professional development of staff to better serve our residents from wherever we're working. We were awarded 2 new grants, the Journey, A Parent's Voice, and the Youth Economic Mobility Grant. Journey improves and increases the delivery of supportive services for parents at the entry point of the child support program. The second, Charting a Course for Economic Mobility and Responsible Parenting grant, is a collaboration with various local partners to develop program activities, skill building that will help teens and young adults gain the knowledge, skills, and resources needed for career mobility, understanding of healthy relationships, and parenting skills. The pandemic reality was compounded by its severe economic toll. Although the economy has rebounded, the stimulus packages and the expanded unemployment benefits that helped lift the economy have now expired. As such, we saw a surge in collections in 2021, but now our collections are dropping rapidly. This economic climate must drive our decision-making, our case management efforts, and how we respond to and support our residents. We've also seen what the media has coined as the Great Resignation. So maintaining agency staffing levels for us has been a challenge as well. It's caused workload stress for our case management staff, trainers, and onboarding staff. As such, our team is also spearheading a recruitment and retention project that will meet these challenges head on. In addition to our participation in the Integrated Health and Human Services One Door project, our key initiatives for 2022 include exploring outreach opportunities and operational goals, such as the implementation of a new phone system for improved communication and resident access to services, improving workflows and processes, tracking operational performance, and completing the organizational workload analysis. With that, on behalf of the agency, our team thanks you for your strong and constant support you have shown to all of the staff of Franklin County throughout the pandemic, and we're happy to take any questions you may have.
Do you have questions, commissioners?
I was
I don't have any.
just gonna ask, I see in the, what are we calling this? The recommended budget summary, that there is a lot of decreases. And if Susan could just, speak to the decreases for everyone.
Thank you, Commissioner Crawley, for that question. The majority of our decreases in our budget are as a result of grant projects that are winding down. So those would be our Families Forward Demonstration Grant, our BICS grant, which is the Building Behavioral Interventions and Child Support. And also we're on our last year of the Procedural Justice Alternatives to Contempt grant. So grant funded programs are what is driving our budget down. Our budget is actually 0.47% less this year than last.
Any additional questions, Commissioner?
No, I'm sorry. I'm looking over. You see me, I'm looking at I got two screens going here.
Okay.
So I'm looking at the summary on here. But no, I'm good for right now. Thank you.
Okay. Any other questions, commissioners? Okay. Next, we will have Director Orville Johns with Office on Aging.
Thank you, Deputy County Administrator. Good morning, good afternoon, Commissioners. I'm Orville Johns, Director of Franklin County Office on Aging. The agency's budget for 2021 is approximately $48 million and provides important services intended to improve the quality of life for Franklin County Office on Aging, Franklin County residents age 60 and older while helping them remain in the homes as long as possible. The population of residents 60 and over in Franklin County is approximately 202,000, and to provide these services, our agency employs 103 FTEs. During 2021, our agency has formed great collaborations with other Franklin County agencies. I would like to highlight two of these amazing collaborations. In early 2020, our agency committed to assisting Franklin County Public Health with COVID-19 vaccination efforts for older adults. We helped schedule appointments and we provided transportation when requested. In addition, our office reimburses Franklin County Public Health $15,000 annually for the purchase and administration of seasonal flu vaccinations for older adults. In collaboration with Franklin County Job and Family Services, we are conducting a community needs assessment focus group survey. The focus groups were conducted through a racial equity lens to address social determinants of health and identify existing barriers to obtaining services offered by the Office on Aging. The priority populations identified for these focus groups were low-income people of color age 60 and older, religiously observant people of color age 60 and older, and African-American men age 55 and older. We were grateful for these collaborations. Key accomplishments. We had pandemic response. During this pandemic, ensuring that older adults continue to receive proper nutrition is paramount. Since March of 2020 to October of 2021, our agency was able to provide over 1,776,000 home-delivered meals to those in need of food. So far, our agency has provided meals to 12,752 older adults in Franklin County. And to address the enormous need for safe transportation during the pandemic, our agency provided free rides to COVID vaccination appointments for 1,022 residents 60 and over. Our office funded 3 innovative technology access projects that helped 225 vulnerable low-income older adults in zip codes identified in the Poverty Blueprint learn and explore the digital world. Our agency also partnered with Central Ohio Area Agency on Aging and Ohio State University's Age-Friendly Innovation Center to conduct a regional community needs assessment for the aging population. The final report, due at the end of this month, will inform us on how we can shape our services to meet the growing and changing needs of the older population of Franklin County. Our challenges for 2022 is that we have identified 4 challenges facing older adults in 2022: the rise in kinship care, financial exploitation, worker shortage, and housing insecurity. Kinship care refers to situations when a relative or non-relative has taken over the full-time care and protection of a child. Progressively, many older adults are being faced with having to take care of their grandchildren. To assist these grandparents, we will utilize our kinship support program, which provides support to 55 and older adults who are caring for minor children. With more older adults being victims of financial scams, our office has launched an educational campaign through TV, radio, and social media to inform the aging population on how to protect themselves. Our providers have reported, under worker shortage, that transportation services and home care is creating a shortage. And since 2020, a total of 15 of our providers are no longer providing services. To explore solutions, we will establish a worker shortage task force to include community stakeholders and partner agencies. Finally, as identified in the poverty blueprint, maintaining adequate housing is a challenge for many residents. Due to the current housing crisis, access to safe and affordable housing for older adults is a current challenge. We recognize the housing needs for older adults will need expanded beyond just access to emergency payment assistance programs. And our goal is to provide a housing navigator to assist with locating available housing vacancies. In conclusion, 2022 marks the last year of our current 5-year levy cycle. Our agency plans to place a $1.75 million levy on the ballot in November of 2022. If the levy passes, Franklin County Office on Aging will be able to continue providing much needed services to our older adult population. The levy is projected to be a renewal, which means no increase in taxes to Franklin County residents. Thank you for allowing us to share with you today, and we're happy to answer any questions you have.
Thank you, Director. My only question is with regard to the levy, given our senior population is growing and our needs are getting higher, how did the levy committee come to the realization of the continuance as opposed to an increase?
Well, we, during our mid-levy review, we explained to them what our situation was with the rise in the population. And at that time, we made a determination not to seek additional funding just because of the nature of the pandemic and the workforce at that time.
It seems like it would work the opposite direction, though, to seek it. Or do you have any concerns about funding then, in terms of being able to meet the needs of our seniors and our growing population?
So we always will have a concern because, as you just mentioned, situations can happen outside of our control. But we felt that we have the proper funding to meet the needs that we are projecting. We're hoping to, at some point, when we're talking about creating a housing navigator, that has come up more recently, obviously, with the housing crisis. And so there may be a situation that we discuss that, but at that time when we presented to the review committee, that wasn't something that we put forth.
Director Johns, can I jump in just really quick?
Yes.
So, Commissioner Boyce, there are several things, as you know, that the levy board requests of Office on Aging before a issue goes on the ballot for a levy. We are working, Director Johns and his team, as well as working with the cross-collaborative team of our Health and Human Service agencies, in addition to the survey that's going out. They're going to also go out and do human-centric engagements with the community before they go back to the levy board to talk about some of the things that they heard from those residents within Franklin County, in addition to highlighting the fact that this is an increase in population in our aging population. And maybe from there, the conversation can shift because we'll have data as well as aggregate data, as well as information that came back from our residents in Franklin County.
Okay. Talk about maybe just briefly, the increase. I know it's not much, but what's the increase going toward?
So the
budget?
the 1.4 million increase is basically being driven by two factors. The first is that we're actually bidding out, we're in contract negotiation for a new case management system. And that additional funding will be toward its implementation. And you've heard us talk about the case management system a few times, that it's long overdue. So we're excited about that. We're in the final stages of the contract negotiations, and we're hoping to get that underway. The second major piece of that is that for the first time, we have put on street a home repair competitive bid opportunity. And under those areas, we actually are trying to take on two new areas, and that's one is there's obviously increased costs in materials that is due to the current economic situation. But we're also added residential cleaning services and biohazard cleanup and handyman services such as snow removal and lawn care. So those are the two your driving forces to that increase.
Okay, thank you.
So I have a question about contracts, or especially the area office on age,
Ojpp?
Yeah, that I was gonna say it has a lot of A's in it, that one, because obviously this came up when I first became the commissioner, and we had our briefing, and there were some concerns about the home visiting not being done by the case managers during the pandemic, even though they had already been vaccinated, and things of that nature. And I'm assuming, honored our obligation on the contract, even though they weren't meeting their obligation when it came to providing services as contracted. What has been the conversation? Because I think at that point in time, the contract was maybe around a $5 million contract. What was the conversation, or what has the conversation been about going out, providing direct services, laying eyes on our aging population? If you could just speak to that, like what are we doing to make sure that doesn't continue to happen?
And Director Johns, can you talk about the improvement in that relationship for Commissioner Crawley as well?
Yes, thank you. And actually, that's the crux of it. Thank you for the question. We have been having regular meetings with COAAA, their team there, to discuss just our expectations of how we would like to care for the aging population. We understand that they have their conditions and their guidelines, but we are encouraging them to visit with our and make more contact with our seniors if possible. But we're also meeting with them regularly just to ensure that is taking place. And we have our senior team and their senior team talking about what we would like to see in the future. So those questions are being addressed, and we're hoping to have some information for you as we move forward.
So Commissioner Crawley, increased monitoring has been put in place, as well as increased intentionality regarding collaboration. What we're seeing, particularly from the operational side for visiting staff, that they are out now indeed seeing our families and residents. I myself will be meeting with their executive director here, I think, in the next several weeks. And she and I are going to have a sit-down conversation and include Director Johns as well. So, in essence, again, increased monitoring, increased intentional collaboration with the partner, and laying out the expectations of what our expectations are versus what their standard policies are.
Okay. And then Director, if you can speak to briefly, in the summary you mentioned, or not you, but it's mentioned about the meals that they have been provided for free during the pandemic. So was that a cost savings? Where are we with that?
No, that was not a cost savings. And thanks to county administration, that was something that we sought for, so we can feed those who are in need. There was families who did not have access to food and was actually afraid to travel out of their home. So we thought that would be a great service to provide. And County Administrator Wilson was supportive of that effort.
Okay, so maybe I read that wrong. Okay, so it was saying, so when I'm looking at it, it said that there was a little over $1 million increase from 2021's approved budget to the 2021 projected budget. And I know that there's an increase of 2 million from the 2021 approved to 2022 recommended. But there was that mention of, about real estate taxes, and then which was partially offset by lower than anticipated client co-pays because of the home delivered meals have been provided for. So if you could just talk about that offset. I guess that's where I'm confused, or maybe we could just have another conversation about it offline.
Yes.
I'm
Yeah. Yes, I'm trying to gain a better understanding, but yes, can we address that offline? Because we definitely have information for that. I'm not quite sure I'm gaining your question.
Okay. Commissioner Carly, what I'll do is we'll have Director Johns reach into your office and he will provide the needed information that you're requesting right now.
Oh,
Outline.
okay. We're meeting
those differences. Yeah.
Well, my staff is meeting up, so I'm supposed to be off today, but and I'm off tomorrow. That's why sorry I have on a sweatshirt. So my staff is meeting with your office. So if you could she knows what I'm trying to get at. So I will be traveling. So unfortunately, I won't make that meeting. But Mariah, who's my policy director, will definitely, she knows what I'm asking.
Okay, thank you.
Commissioner, this is Zach. I can chime in. So I think in terms of the document you're looking at, Commissioner, in terms of the client copay revenue being less than anticipated, I think when the budget for 2021 was developed, I think the thought was to reinstate some of the charges for home delivered meals sooner during the year. However, because of the length of time that pandemic has been ongoing, the extension of the fee waiver has been extended. So that's why the revenue was less than what was originally anticipated when the 21 budget was approved last December. And then on the flip side, the real estate taxes, because collections were strong during the calendar year, there wasn't any decline due to the pandemic. That's the reason for the higher than anticipated revenue.
Thank you, Zach. I appreciate it.
Commissioner Crawley, if I could go back really quick to your previous question regarding COAAA, Director Johns and his team will be working with internally, they will be working to write a new contract with new expectations when that time comes up, so that those expectations are laid out on the front end.
That was what we were going to ask offline, because it doesn't matter if you talk about it, if it's not contracted, if it's not in the contract, if it's not written, it doesn't exist, right? You can't be held to it. So I appreciate that. Thank you.
Thank you.
Thank you, Director Bivens.
Absolutely. Any more questions? Okay.
Thank you.
Director Pride, Justice Policy and Programs.
Good afternoon, Commissioners and County Administrators. My name is Rochelle Pride, and I serve as your Director for the Office of Justice Policy and Programs. On behalf of our office, it is my honor and privilege to present our fiscal year 2022 budget request, an overview of the past year's highlights, along with challenges and future objectives. While 2021 has continued to raise uncertainty due to COVID-19, the Office of Justice Policy and Programs is proud to report on numerous accomplishments, highlight our response during the pandemic, and reflect on equitable justice goals for the coming new year. Ojpp 2022 recommended budget is $7,922,082. Despite an 153% overall budget increase between 2019 and the proposed 2022 budget request, which includes the addition of CASA operations in 2020, the percent of general fund subsidy supporting Ojpp has gone down from 19% to 16% of the total budget. Ojpp has managed to increase revenue from local, state, and federal grants by 130% between 2019 and 2020 to support VOC priority initiatives. In September 2022, 3 considerably large grant programs will expire, thus our need to double down on sustainability planning. Grants are intended to evaluate proof of concept and success, which we have done. Therefore, securing long-term reliable funding is paramount. In addition, CASA staff added 10.75 FTEs effective July 1 of 2020. At this time, I'm excited to highlight Ojpp 2021 major accomplishments streaming from a few of our most progressive initiatives. Through CASA's hard work and court-appointed advocacy, legal and support services were provided to 617 children experiencing abuse and/or neglect beginning January 1, 2021 through September 30th. Treatment linkage and overdose prevention resulted in 132 justice-involved residents at risk for overdose to be linked with treatment services, including medication-assisted treatment pre-release. Our enlarging footprint in reentry resulted in service to 1,224 justice-impacted residents and their families through our new Rapid Resource Center as of October 2021. The RRC began serving residents in February of this year out of our Jackson Pike Correction Center and reinforced the notion of meeting our residents where they are and supporting their next step. Our efforts to address domestic violence and interpersonal violence prevention birthed a multidisciplinary launch of our Franklin County Blueprint to Safety initiative, which seeks to emphasize a system-wide approach focused on victim safety, offender accountability, and collective response. Due to stellar grants administration between CY 2019 to 2021, Ojpp experienced a 134% increase in grants secured to support key Franklin County initiatives and priorities. Next, I would like to expound on Ojpp 2022 anticipated challenges and key policy goals. The fentanyl crisis developed a need for Franklin County's second safer station location, which will launch in the Hilltop area, offering wound care, immediate referral, linkage, and treatment services. Our trending housing crisis makes it necessary for Ojpp to continue smart investments in transitional housing models that integrate safety and support with combined goals of reducing recidivism and increasing long-term housing stability. Smart justice will be prioritized through regular convening of justice stakeholders to address disparities in equitable justice practices, implementation of jail population review process, data-informed bond and sentencing reform recommendations, and focusing strategies to decrease the overrepresentation of incarcerated residents with a mental health disorder. Ojpp will work with the Franklin County Sheriff Office and local community corrections organizations on our Children of Incarcerated Parents program to develop a better understanding of the prevalence of children impacted by parental incarceration, addiction, and develop outreach and advocacy routes to expand support and access to trauma-informed services. In alignment with our HHS ecosystem and collaboration with our Family Stabilization Unit and Nationwide Children's Hospital, Ojpp will oversee implementation of a new countywide Youth of Incarcerated Parents initiative. The focus of YIP is to support youth and families coming from all intercepts of our system and embed a standard of restorative practices to reinforce transformation. Lastly, Ojpp program sustainment will consist of an in-depth review of current funding strategies and portfolio to better align efforts with the longer-term policy goals of our newly established HHS ecosystem and reduce reliance on grant funding to sustain core programs and related staffing. Commissioners, on the heels of our major accomplishments, I would be remiss not to mention our treasure of amazing private and public partners. The list of meaningful, intentional relationships we have cultivated is extensive and undoubtedly the bedrock of our work and the greater success of our service. I would like to take this moment to extend a heartfelt thank you to our partners. We appreciate your collaboration and look forward to our continued growth. In closing, the past 20 months has presented its fair share of challenges. Our agency has remained resilient and committed to its overarching vision and mission, which would not have been possible without the unwavering commitment of our Ojpp team and support from County Administrator Ken Wilson, Deputy County Administrators Joy Bivens, Chris Long, Eric Janis, our former clerk, Dean Hindeling, Clerk Brittany Razik, and the entire OMB team. And finally, to you, commissioners, we are grateful for your intentionality and collective vision as outlined in our Franklin County Rise Together Blueprint for reducing poverty to ensure a thriving community. To be grateful is to be humbled, and to be humbled is to remain benevolent in our work toward a greater Franklin County for every resident, every day. Any questions?
Yeah, I'll start off. Thanks, Director. That's a good presentation. I just realized something. You get no general fund dollars? You get zero
There
gen-
is, no, we do get general fund dollars, Commissioner.
Oh, okay,
We
okay.
do. Yes, sir. It's just we've been able to keep the subsidy maintained while increasing the grant allocation.
So
Just the same.
how much do you get from general fund of your
Um,
budget?
I can get those specific numbers
Okay.
for the, and I have Melissa Pearson on too to jump in to give some more historicals as it relates to that, Melissa, if you don't mind giving those specific numbers, please.
Sure, and Commissioner, if we back up 3 slides, I think you can see the exact revenue that's been brought in through grants versus what we are bringing in through the general fund dollars.
Mhm.
Here it should be right there. So you can see our
Ah,
subsidy
okay.
for this year is about 1.2 million. We've kind of
Okay.
kept it around that same, since we've absorbed CASA, that's remained fairly static.
Yeah, I'm looking at the actual budget document on OneDrive, and I don't know, maybe I'm just reading this wrong because that's not those aren't the same numbers that are on this. Zach, are you on?
Yeah, Zach, can you?
I'm here, Commissioner, and I think if the number, just looking at the probably the interfund revenue, which is which would equate to most of the subsidy, would include that 1,263,000 that Melissa talked about. There is also a cash match for a couple of the grants that totals roughly about 50,000, which is the remaining difference, probably between the number that's in the budget brief and the
Yeah,
slide.
I don't see anything on the budget briefing. I don't know. I could just be reading this wrong. It's a lot of pages. So, my budget briefing, it just says 0. The brief that I read.
And on that, Commissioner, because the budget flows through a special revenue fund, it shows up as non-general fund. The revenue, because it flows through a special revenue fund, it does not show up there. So the general fund expense for the subsidy shows up in the commissioner's budget as a payment, and then the revenue comes in as a non-general fund revenue to justice policy and programs.
I see. Okay. All right. I mean, we should always try to have consistency in the documents being that they're presenting versus what we're looking at. So that's fine. But Director, back to you. So really your work is core to some of our work in the jail. With this new facility coming online, I think your policy work should be a little more elevated in terms of that planning and strategy. Is that conversation happening? Is that is there opportunity for more discussion there with the jail and just kind of some of the work directly?
Absolutely, Commissioner Boyce. We are very embedded in that process of planning for the new jail as it relates to programmatic and policy-related initiatives. We actually have an upcoming meeting that, again, they are ongoing with Director Butler to kind of hone in on that and make sure that we are being preventative and forecasting what the programmatic structure should look like in that very space. So we have our hands in several spaces as it relates to the new jail, what that's going to look like coming in the door from intake to also that post-release process.
Yeah, I want to encourage you to really drill down deep in that, specifically where you can align the blueprint work to this new jail into justice policy and programs, and really zero in. And if there are budget needs there, I think now is the time to talk about that, because as the jail comes online next year, we really want to be having all cylinders firing right. And now would be the time to look at any budgetary needs you might have to address some of those issues. So I just push back on you a little bit to say if there are areas of opportunity here, now would be the time to sort of drill down on those.
Yes, sir. Thank you. We will
Sure.
definitely do that.
Okay.
Any more questions, Commissioner?
Yes, thank you, Director, for your overview, your presentation. One of the things that I wanted to ask about is your reporting, since you have a lot of grant work, and can you speak to that? And well, let me go down. There are a lot of pages, and I'm sorry. So for like the programs that you have for 2022 that are, because I guess most of your budget, or 69, almost 70% is grant work, and having to, provide different metrics. Where are you with, and are those reports available for like the commissioners?
Yes, those are evaluation and reports as far as the tracking of those grants, and the federal reporting can be made available and are available based on where we are in that reporting structure for those particular federal grants. So absolutely.
Okay, and then you have, can you talk about the number of grants that you have for the 2020 year?
2020 year?
What programs those are?
Okay,
So I
Melissa,
see you have grants to other, you have just grants over in general, then you have grants to other governments, grants for nonprofit, and then grants to other providers.
Yes, Commissioner. Melissa will definitely be able to outline that for you. Thank you, Melissa.
And Commissioner, I just want to make sure that I understand. You're asking for the upcoming year or going back to 2020?
So I was asking about the reports for 2021, but I'm asking, I want to know if the reports for 2021 are available or could be made available.
Sure.
But then my other question is for what grants do you have or are anticipating for 2022?
Sure. So our office in 2021, we administered 26 separate block grants. Some of those are formula, so they come to Franklin County as a result of our population and our crime rate. And some of those are discretionary, where we've actually sought the funding from other state and federal grant programs. For 2022, we're going to stay right about that 26 mark with the federal grants coming in. We are awaiting one block grant or one discretionary grant award announcement that we expected to come in earlier, but it hasn't gotten here yet. So I think we'll stay right around that 25 to 26 block grants. They each come with their own nuances, reporting requirements, but all have a reporting requirement. Most are quarterly, and we can certainly forward any of those reports to you. We have a database where we track all performance indicators. And as it relates to any direct service work that we're doing inside the jail or post-release, for reentry purposes, we invested in a virtual case management system, which has allowed us to take our data and our metrics to the next level. So we can provide you with as much data as you'd like, probably more than you'd like, and we can prepare some of that for you over the next few days. For 2022, of those 26 grants, that will result in roughly about 70 to 80 sub-recipient awards being issued to our local partners. And that includes local government partners, nonprofit organizations, faith-based organizations. And again, we can get that list to you.
Okay, great. Thank you.
Sure.
And Commissioners, as you see, Justice Policy and Programs, it's heavily operated through their grants and also through subsidy from the general fund. But I want to make mention before we move on, Director Pride mentioned the work that we're working on with youth of incarcerated parents. Right now, we have identified that when adults are entering into the jail system, there is no indicator to ask an adult, do you have children and who will be taking care of those children while you were incarcerated, whether they live in the home or not. I commend Director Pride for working with, first leading that work, but also working with our Deputy Director in the Family Stabilization Unit to get that stood up. And if there are not any more questions, would you like to move on to our last presenter, Commissioners?
Sounds good.
Okay, so next we have Deputy Director Walter Dillard for our Family Stabilization Unit.
Thank you, Deputy Administrator Bivens, and good afternoon, Commissioners. My name is Walter Dillard, and I serve as the Deputy Director for the Family Stabilization Unit. and strategic initiatives for Franklin County. The Family Stabilization Unit, or FSU, was birthed in a time where the nation was crying out for justice. Franklin County and the Board of Commissioners were intentional in addressing systemic racism and disparities in our communities by declaring racism as a public health crisis and developing the Poverty Blueprint Plan as a way to break the cycle of multi-generational poverty and for other purposes. These steps were just the beginning of a shift in multi-generational systems. So since the establishment of this initiative, our units have been strategically placed in the court systems to assist youth who interface with the juvenile justice system. Our approach was created under the pillars of the social determinants of health, and the services we provide to families also fall within each pillar. In lockstep with the generational model of the human services value curve, our mission is not to only help families enrolled in FSU with stabilization, but also to use the data that we collect over the years to help combat policies that have afflicted our most vulnerable residents. Currently, we are assisting 73 families with a total of 307 participants enrolled in the FSU. However, over the year, we've helped 760 total residents so far. This is all because of our specialists. Having them on staff is what makes this actually possible for Franklin County. Our families are experiencing inequities that range from food insecurities, lower levels of education, under or unemployment, or lack of positive male role models. These families were completely bereft of resources to help combat these issues until FSU stepped in. We see grandmothers raising their kids' kids and single mothers raising kids that have kids. And we see these top areas experiencing these inequities that live in 43211, the 43206s. And you know, I could further explain the disparities from our families. However, I want Ashley Briggs, a single mom that's enrolled in the FSU, to kind of give her experience of FSU.
FSU to me has been my support system.
In what ways?
My confidence to keep going and to look for housing, to pick me back up, to let me know that I can be what I used to be, because I lost that somewhere along the way.
To further assist our families in the alignment of our purpose and the needs of our communities, FSU plans to expand at a collegiate level through Columbus State and Ohio State, K-12 education levels through our school districts, and a mobile unit for accessible assistance to our communities. College unit, 78%. 78% of single mothers who are students come from economically poor communities. And of that group, less than 25% obtain their degrees when compared to their low-income non-parent counterparts. This college division will be specifically catered to assist African-American mothers complete school. And I know many of you are probably thinking, how is this any different from the comprehensive programs that are in place for mothers that are in college? Well, what the research has showed us is that these comprehensive programs are very present, but vulnerable students still struggle to stay enrolled. Getting mothers through college is not the only piece to this expansion, however. Instead of just pushing mothers to cap and gowns, we also need to strategically partner with resources to employ these mothers in their field of study after they complete it. Many single mothers struggle with income and employment. They want to complete a degree that they know that will have a job aligned for them at the end. So through this approach, we're shifting that cycle of poverty, right? A mother completes school, receives the resources along the way, and is placed in employment that increases her income, which then influences where she lives, where her child attends school, even her federal poverty limit. So if you could close your eyes and imagine having three sisters. One is a single mother with an 8-year-old son who was only able to complete one semester of college. That's my sister. In every piece of this expansion, I think of my sister and what she would have needed if a program like this was there to assist her. But we will also expand into school districts, placing specialists in preschools, middle schools, and high schools. But first, let's talk about preschools. Black girls are the fastest growing segment of the juvenile justice system population, and to ignore this would be the antithesis of racial equity. To address this evident issue, we will use the Rise Together Poverty Blueprint Plan and placing specialists in 3 early learning centers or preschools in the highest poverty areas. However, we know to truly implement change in the system, you must influence policy. So we'll track the data that deals with parents enrolling in the Columbus State, housing stability, food stability, and much more to see exactly what policies are hindering our most vulnerable. So what is it that we need? I want to emphasize two specific things that FSU needs right now: capacity and structure. We have 8 specialists currently averaging 12 families. On average, that's about a little over 60 residents apiece. By the end of this year, we'll have all 12 positions currently allocated to FSU filled. Remember, 2 of those spots are across collaboration with the Office of Justice Policy and Programs and the Youth of Incarcerated Parents Initiative. The work of our specialists is expected to increase within the unit expansion that we have planned. So to meet the need of our community, we have to remodel our structure to 5 specialists a team with 2 administrative officers or AOs overseeing 3 teams each. With 6 total teams, our number of specialists for 2022 would total 30. With that in mind, we will be requesting a total of $1,742,200 to support personnel costs for 18 additional specialists at $1,647,000 and 1 additional AO at $95,200. FSU was created to combat issues of racism and how it and the systems that it permeates afflict our Black communities. Franklin County declared racism as a public health crisis and aligned agencies together with the intention of assisting our low-income families and communities of color. To provide anything less than this is a disservice to Ashley Briggs, who you heard from earlier, and the foundation of FSU and this county. So at this time, I will field any questions you may have.
I'm just trying to, so the budget request is for an additional, how much?
It has not been it's not a formal budget request, Commissioner. What the Deputy Director is requesting is, if he could increase his staff, then this would be the anticipated number he would need in order to increase in order to take care of the needed families that they have.
So why isn't this in JFS's budget? I'm curious.
If you remember when we started FSU, we put it under the general fund because they're not only taking care of families that are TANF eligible, they're also taking care of families who are on that benefits cliff so that it can be more agile.
So is it operating like a department then?
A pilot, yes, sir, yes.
But a standalone department?
A unit, yes.
But it's embedded.
Not from a budgeting.
It's embedded in JFS, but it's not operating outside of JFS.
This is County Administrator Kenneth Wilson, President Boyce, Commissioner Crawley, Commissioner Gray. It is budgeted in JFS,
right.
But when it was conceived, we needed to have the flexibility built in to turn no youth away or no family away that was identified that had the need. So it's funded from the general fund, approximately, and it's embedded there in JFS, and was funded for us to continue the work at the level where it's at right now, and the step towards Columbus State is approximately 1.45 million of general fund money that supports it at this point. What Deputy Director Willard is referring to is additional expansion dollars that will be needed as the program evolves through 2022 into 2023.
So where is this? I don't see this. Is this in the budget document for JFS then?
It is. It is paid. It is paid into JFS's budget. It's supported as to get into the weeds. It's funded through, just like there are a number of grants that flow through JFS that are funded from the general fund and a combination of TANF. As we spoke to earlier, for example, Building Futures and Driving Futures are a hybrid funded initiative from the general fund and TANF dollars.
But just to clarify what's included and not included in the JFS budget, the budget for the existing 15 positions of FSU is included in our 2022 budget.
Yes.
The proposed expansion that is just being discussed now is not currently reflected in the JFS 2022 budget.
Okay. Okay. I mean, I don't think we need to, we can talk about this offline, but, okay, thanks. I don't have any more questions.
Commissioner Crawley, do you have questions?
I have an additional question. Commissioner Boyce asked my question because I was trying to understand the budget. And FSU only had like one page of Job and Family Services budget summary. I guess is there any additional sources of funding for FSU, or are there any grants that you all have gone after that you've been awarded?
So we're working on that now on a more of a federal level. We have been told there are $2 million allocated in the federal budget of Health and Human Services. However, policy has not been written for those $2 million. We're hopefully going to be working with our partners at NACO as well as the Aspen Institute, because as you all know, the motto of FSU was recognized under those organizations, and to help us to assist us in directing us to some of those federal dollars. And hopefully we can obtain those dollars in order for the expansion.
Okay.
And let me clarify, the boxes sit under JFS and is funded, yes, but the team is cross-trained in all the Health and Human Service agencies. So it's not, they're not able just to process cases. They're familiar with the work with Office of Aging, Justice Policy and Programs, Adam H. The team has been cross-trained in all the Health and Human Service agencies so that we can eliminate what we talked about earlier with that, with the burden of families and residents jumping from system to system to obtain what the needed resources that they need.
Okay. Okay, and so the request is 1.7 million for the personnel
Additional.
costs. So is there any other programmatic costs?
So they, go ahead.
I'm sorry. So the request that I had, that was for to include salary, benefits, supplies, equipment, data services, training, mileage, and reimbursement. We do have supportive services dollars that we still have left over that we can still utilize. So that wasn't put into the request.
Okay, how much is that?
200,000. How much do you have left, Walter?
Close to 170.
Okay. Okay. I don't have any additional questions at this moment. Thank you, Walter. Great overview.
Or do we have any more questions, commissioners? As we continue to fight COVID-19, we cannot lose sight of our shared goals of eliminating generational poverty in Franklin County. A critical piece of this goal is streamlining health and human service delivery to our families and residents. An estimated 300,000 residents interact with more than one agency, 220,000 with 2 or more, and 56,000 with 3 or more at the time. The time spent juggling agency costs are residents' time at work, school participation, in spiritual and community activities, and spent with their families. And of course, our communities of color are disproportionately accessing our services, making this an equity challenge as well. Therefore, in 2022, we will launch our One Door Franklin County project. With that, I would like to highlight the One Door Franklin County project was a vision of the Franklin County Commissioners. An overarching goal for One Door Franklin County is to recenter our systems and processes, starting with Job and Family Services, Office on Aging, Child Support Enforcement, and Justice Policy and Programs around families and residents. One Door will not only address breaking down our current siloed systems, but will work to move from a regulative model to more of a generative service approach. We will employ techniques such as human-centered design, predictive analytics, and behavioral economics to better serve our families and residents. Over the course of the next year, my human services team will conduct an interactive landscape assessment at all 4 Health and Human Service agencies and make recommendations on how to achieve a one-door service delivery model with the use of these innovative tools, and also by benchmarking leading national and global best practices. Last year, I used my testimony to express our county and our entire nation is in a moment of reckoning. It's a reckoning around racism. It's a reckoning around the gaps and disparities in our system that have always existed, that have had spotlight shown on them in this pandemic. I would like to end my testimony this year by saying that I believe our county, our country are in a moment of great opportunity for change. From the hyperlocal to the federal level, we have an opportunity to build back better, an opportunity to bring every family and every resident along with us as we begin a new era in health and human services delivery in Franklin County. Thank you.
Thank you. Thanks, everyone.
Thanks, Joy, and thanks to the Health and Human Services team. Commissioners, that concludes today's budget hearing. Our next scheduled budget hearing is at 1 o'clock on November 30th, where we're scheduled to hear from the Sheriff's Office, Public Facilities Management, and the Office of Diversity, Equity, and Inclusion.
Thank you.